Greetings. My video message to you today is how nice to see you. I'm situated right now in room 1411 at the Tufts University School of Dental Medicine. This happens to be one of the best simulation centers in the world, and I have to say the views are pretty awesome as well. The faculty and staff that have been and are devoted to your teaching in these spaces have been second to none. Many of you have spent countless hours here learning about operative, endodontics, pediatric dentistry, and fixed prosthodontics. And yes, some of you might even have spent a little bit of time in this room learning about periodontology. Remember the 1314 Gracie curette and how you learnt about which surfaces it's used to clean? Remember how frustrating it was to try to identify the cutting edge? Yes, for some of you that are newbies, hold the instrument with the terminal shank towards the ground, look straight at the blade, and the part that is facing the ground is the cutting edge. Over many hours and through many frustrations in this room, you all gained confidence that allowed you to progress into clinical practice. You have practiced here to hone your skills for your licensure exams. In this new world, some of you in your clinical years might re-enter this space to keep up your hand skills. Well, today, like many of the learning and clinical spaces at 1 Neeland Street, this space is empty. When you look outside these windows, you also notice that the streets below are empty. No traffic, so to speak of. On occasion, the silence is broken by sirens, a constant reminder that a patient who might be stricken by COVID-19 is headed to the Tufts Medical Center. We know due to the efforts and sacrifices of all, these events are becoming less frequent. We thank Tufts Medical Center for all they have done and are doing as the frontline workers that are confronting this disease. I am also thankful to the faculty, students, residents, and staff that come to TUSDM on a daily basis to see and care for our emergency patients. All of these healthcare workers, in my eyes, are our heroes. We are now getting used to hearing about a phased resumption of services, a phased resumption of our outside lives. We see states opening up in phases. We see phased guidelines coming from our federal government. As we step out into this new world, we feel the sun on our skins. We breathe in the fresh spring air. We see flowers and hear birds with a crispness that is invigorating. We all feel hope. Here at TUSDM, our attention has also turned to resumption of services in the clinical, preclinical, educational, and research arenas. We hope to return to clinical activity in the coming weeks. We are now in what we call phase 0, where we provide emergency services with an essential workforce. We have plans for our phase 1 openings for our AG programs, followed soon after by our DMD programs. An emphasis being placed on patient care needs and DMD student resident needs, especially those students that are in their final years and need to complete their programs. Phase 1 has also included classifying our senior students as essential, since they have to join the oral healthcare workforce to provide emergency and essential services for patients in private practice and in residencies. As we implement new guidelines and protocols for practice, we will enter phase 2 and 3 of our plans in conjunction with state and federal guidelines. This week, I could not help but get emotional when I saw some of our D20 students entering the building to clear their lockers for graduation. As I walked into this space as well this week, I was also reminded that we have crossed another threshold. For the first time since our shutdown, we had students in this space completing clinical requirements for their graduation deadline. Each D20 that I saw was working with a focus and diligence. Here for a purpose, here with a faith, here to finish up and move on, to become the future hope of our profession, the future of our Tufts Dental family. Being able to conduct our first in-person education-based exercises is a first step, a small step into a new world. To see the faculty, Drs. Saavedra, Dr. Arsenault, and the other faculty is a first step. To see staff, Maggie Dwyer, Paula Callahan, and the student clinical affairs teams work together is a first step. To see students in person is a first step. I say from behind my mask, how nice to see you. How nice to see you in person. It may be a whisper, it may be a thought, but it is a step into a future we don't know about. How nice to see you.